What you're looking at is not from a science fiction film, but rather a miraculous laser prostate procedure called Transurethral Resection of the Prostate, or TURP. It is performed here at the DMC by Dr. Richard Santucci, Specialist-in-Chief Urology for the Detroit Medical Center.
The prostate is an organ that continues to grow throughout life. So every year that you're alive, past the time that you're an adolescent, your prostate's growing about 2% a year. And unfortunately, in some men, that creates an obstruction in their urinary flow, and they can't urinate properly afterwards. Some people can't urinate at all.
Dr. Eric Jones is a pediatric orthopedic surgeon here at Children's Hospital of Michigan. He experienced this problem while out of town on vacation.
I woke up at night, felt like I had to go to the bathroom, but I could not go to the bathroom. And I tried and tried and tried for a couple hours, walked around, did all kinds of things, and I never had anything like that before, and realized that I needed to go into the emergency room.
A catheter was put in to help Dr. Jones drain his bladder until he could return to Detroit.
The TURP operation was developed maybe 60 or 70 years ago to shave out the blocking part of the prostate. It was a very solid operation that worked for a very long time. Thank goodness, though, we've been able to pull the TURP into the 21st century, and now we use a laser, actually, to remove the blocking part of the prostate, and that has a lot of beneficial effects for the patient.
Beneficial indeed. The original TURP procedure, which incredibly is still being performed in some medical centers, was effective, but had its drawbacks.
That the patient would be put to sleep or get spinal anesthesia, and a rather large metal telescope would be placed into the penis, and that's the way that you would get to the prostate and be able to look at the prostate. Then an electrified loop was used to shave out the blocking part of the prostate. The difficulty with this, and this was great circa 1940, is that the amount of bleeding from this operation is extreme. And you have to have a catheter then inside your bladder afterwards that actually runs water in your bladder and out again just to keep the blood flowing out, because the clots will form otherwise. It wasn't very nice.
Dr. Jones and others facing this surgery don't have to worry about those circumstances.
We're able to use a smaller metal telescope and a little laser fiber that goes through it, and the laser fiber has a visible light that you can see. The laser itself is invisible, actually. And that wherever that light shines on the prostate disappears, it vaporizes. And in most cases, there is absolutely no bleeding whatsoever. In a significant percentage of the cases, they don't even need to have a catheter inside them. They can just leave the operating room and go urinate normally. It's almost miraculous.
Are we looking at the prostate right now?
We're actually looking right at the prostate. And instead of seeing a nice open channel, you're seeing a lot of blocking prostate tissue there. So now what we're ready to do is to use the laser beam to begin taking out the prostate tissue. The real benefit of this technology is that it doesn't cause any bleeding whatsoever. You shine the light on the prostate and the prostate disappears, kind of like science fiction. When we first started, we had a completely blocking prostate, and already we've got wide open area here. The operation isn't completed because we like to take away even more of the blocking prostate so that the patient has a really, really good result. But you can see that the operation works as promised. The laser shines on the prostate disappears, the blood loss is minimal or none. And if we look at this at the end and say, wow, that looks really wide open and there's no bleeding, we're not even going to put a catheter in, and the patient's going to go home today, no catheter.
You're home the same day in most cases. You don't have a catheter in most cases, and you're really able to get back to your life very quickly.
I spend seconds again in the bathroom instead of minutes emptying my bladder. It's faster, easier.
To learn more about this faster and easier TURP procedure, or to make an appointment with Dr. Richard Santucci, log on to dmc.org or call 888-DMC-2500. I'm Emery King.